We're on your side with tonight's cover story. Hospitals overcharging. You have heard it time and time again. Hospital systems telling all of us, they treat Medicare patients at a loss. It's one of the reasons that they used to justify charging other privately insured patients more for service. You're making up the difference. A new report by the North Carolina State Treasurer and Rice University says that whole premise is just not true. The report found while our hospitals were claiming $3.1 billion in Medicare losses in 2020, they actually profited by $87 million. In fact, 2/3 of our more than 100 hospitals between 2015 and 2020 made money off Medicare patients. Again, those claimed losses used as justification for the rising cost of everyone's health care. And that gets to why this matters. It's estimated working people spend 20% of their income on health care. Half skip necessary care because of those costs. Our investigative reporter David Hodges has been digging into the cost of health care and the burden it's putting on families, and he has tonight's cover story.
I was shocked because I felt like they serving me this now when all them years I thought it was taken care of.
This summer, WBTV interviewed Patricia Durham about the lawsuit she was facing from Atrium Health for a medical bill more than a decade old that cost her more than $40,000.
How can they set me up on a payment plan when I ain't got no money to do a payment plan?
In response to WBTV's reporting on lawsuits and collection practices on medical debt, Atrium Health has mentioned how much free and uncompensated care it offers, which includes hundreds of millions of dollars in what the hospital system claims is unreimbursed costs from Medicare.
They are misleading. It's impossible to tell why their numbers are so different.
Tuesday morning, officials from the North Carolina Treasurer's Office, the State Health Plan, and Rice University unveiled a new report disputing North Carolina hospitals' reported Medicare losses. Data reported by the hospitals, but on different forms to different government departments, showed the discrepancy. The report finds that while Atrium reported Medicare losses of $640 million in one place, on another form, it claimed nearly $120 million in profit in 2019. The number matters because it impacts how much you pay for health insurance and how much your employer charges you for that insurance.
Literally, there are millions of people who will never see a raise at their job because the premium cost next year to their employer will eat up any increases in productivity.
Not only are employers and the state paying too much for their health insurance, but it is also the case that it seems that North Carolinians are losing out on community benefits that these nonprofit hospitals should be contributing back to the public because of the tax breaks they receive.
North Carolina Treasurer Dale Falwell says instead of community benefits, the money goes to growing bigger hospital systems, which he calls the cartel.
Atrium Health, who's the biggest player of the cartel in North Carolina, has over $12 billion in the bank this morning. So these hospitals have lost their mission. They have turned into investment banking, real estate development companies.
State Treasurer has really made this a cause, no question. Our investigative reporter David Hodges joins us here in studio. First up, any response from Atrium on this today?
Yeah, we did reach out to Atrium, and they said they just categorically denied the findings of this report, saying that the conclusions that were found in some of this report were not based off of all the records, and they actually sent us a long statement on some of this, saying that about that the initial review of that report appears to be based on completely false premise and thus incorrect conclusions. They also said that more recently in 2021 that they had unfunded costs of $85 million at the hospitals alone for Medicare costs. But the point that they were making in their statement was that this report didn't have some of the necessary forms and paperwork to reach that conclusion, which was really the point of the entire report, that there is a lack of transparency on these records, and why there are different numbers in different government forms doesn't make any sense It should be a lot more simple than that.
Is this an issue for all hospitals? Obviously, Atrium very large. What about smaller hospitals?
What the research shows from this is that it is more felt in some of the bigger hospital systems. So some of the more rural, smaller hospital systems, you don't see as much reported Medicare losses, and thus you're not seeing the type of discrepancy on what they're saying they're contributing to the community and Medicare losses versus how much money they're actually making. Very small discrepancies there.
It was really interesting, too, because the treasurer mentioned where the money is going. Said the hospital system sometimes acting like an investment bank or a real estate firm. What did he mean by that?
Well, you can see what's happening right here in Charlotte. Atrium Wake Forest Medical School starting the Pearl, the innovation district here in the Charlotte area. It's supposed to be this huge real estate development and, of course, medical school as well. And then you hear about $12 billion in the reserves for Atrium. And then there's other research showing hundreds of billions of dollars that hospitals have in reserves that they're spending to try and grow the hospital system. What nonprofit do you know, does anyone know, that is spending money on an innovation district or has billions of dollars in reserves when there are a lot of people who aren't getting the care that they need or at least aren't able to pay for the care that they need?
And some patients being sued because of the bills
as we
that
have
they
previously reported, or garnished, or any number of things.
David's done terrific reporting on this. You can find it all on our website. Go to WBTV.com. David, thanks for stopping by and walking us through this really important information. You bet. Tell us your thoughts, by the way. You can connect with us on Instagram and Twitter using the hashtag OIS Tonight. You can also scan the QR code you see there on the screen to get to our mobile menu, where then you can write us an email. All right, Ryan.